Hi everyone, good afternoon, and welcome to another webinar hosted by the Faculty of Pharmacy of Masa University. If you are new to our session, the faculty conducts monthly webinars to promote the faculty's expertise as well as share crucial information with the audience. Today, we have our very own Madam Wati from Clinical Pharmacy and Mr. Sharizal, our clinical instructor, who will today discuss the role of pharmacy technicians. So without further ado, I would like to invite Madam Wati to kick everything off. Madam Wati, go ahead.
Thank you so much, Mr. Danish, for moderating the session. Okay, Assalamualaikum warahmatullahi taala wabarakatuh, and good afternoon, everyone. Good afternoon to all our students, our existing students, our prospective students, and also the audiences. Okay, for today's webinar, this is the first webinar from the Faculty of Pharmacy for 2023. And for today's, the title of the webinar is Communal Role of a Pharmacy Technician. Okay, in general, a pharmacy technician is a person who have already obtained a diploma in pharmacy certificate from an accredited program in Malaysia, and the normal and common role of a pharmacy technician are as follows. And as you know that the pharmacy technician works closely with the pharmacist to ensure the health and safety of their patients. And these are the roles for the pharmacy technician. The first one is supply medications to the patients. The second one is provide information to patients and other healthcare professionals. The third one is manage areas of medicine supply, such as dispensaries. The fourth one is supervise other pharmacy staffs. The fifth one is produce medicines in hospitals and in the pharmaceutical industries. So as now the pharmacist role is also developing in other ways, that is patient-oriented roles, so the development of pharmacy technician roles in the industry. Today's pharmacy technician is an integral member in the healthcare industries. Pharmacy technicians actually play a vital role in delivering medication to the patients and also assisting pharmacists in their daily task. At current, pharmacist roles are transitioning from one of dispensing medications to one of healthcare provider. It is now is a transition period of from the traditional dispensing medications towards the patient-oriented role. And therefore, as the pharmacists are now involved in actively managing patient care, the role and responsibilities of the pharmacy technician is also undergoing significant change in the industries. So for today, Mr. Sharizal, the clinical instructor from the Faculty of Pharmacy, who have 13 years experience in providing services in private hospitals, will be sharing her points of views. Okay, so Mr. Sharizal, the floor is yours. Thank you.
Okay, thank you, Madam Wati and Mr. Danish. Okay, today I would like to talk about communal role of pharmacy technician in hospital pharmacy. Okay, actually, what is hospital pharmacy? So, hospital pharmacy is to provide optimal pharmaceutical care to cater for the needs of patient and hospital customers, and to ensure management of drugs and non-drug efficient for patient and hospital customer. So, who is a pharmacy technician? Okay, from the American Society of Health System Pharmacists, pharmacy technician are defined as a healthcare professional who works under the direction of a pharmacist to help prepare and distribute medicine to patients. Okay, what are the main role of pharmacy technician? pharmacy technician in hospital pharmacy. So here are a few main roles for the pharmacy technician, which is to supply medication to outpatient or dispensing medication to patient, supply medication to inpatient to the ward, compounding and extemporaneous preparation, organizing inventory drugs and items, and also to prepare aseptic technique preparation, example like cytotoxic drug reconstitution and the total parenteral nutrition. And the other pharmacy technician typical job duties are they have to provide customer service to patient and hospital customer in person and over the phone. And also, the pharmacy technician have to the pharmacist for an extra question or concern. Okay, so now we go through what is the pharmacy technician do in the outpatient mostly. So, what is dispensing? Okay. Dispensing is refers to the process of preparing and supplying medicine to a named person together with clear instruction, advice and counseling where necessary on the use of those medicines. So here are the dispensing process in the hospital pharmacy. So from the picture here, we can see a pharmacy technician doing a screening the prescription after receiving manual or digital prescription. So what is a screening? So screening is to make sure it's a valid prescription prescribed by a doctor to check for the dose and drugs are appropriate for the patient. Uh, Currently, most of the hospital are using the digital prescription. That means the doctor will prescribe in the system, then the pharmacy will get the prescription through online or in the system. After pharmacy technician screening the prescription, then they go to the next process, which is preparing and labeling the medication correctly. So, so the process of preparing medication is we prepare the medication based on prescription and label it correctly. And after we have prepared and labeled the prescription, we go to the next process is the checking the medication before dispense to patient. Same person who is doing the screening and preparing. Okay. After the checker have checked the medication is correct, then we go to the next process is dispensing medication to patient with correct drug and instruction. So dispense the medication to the right patient, the right drug, and right instruction to the patient.
Ini pasal balik.
Live Okay. Hi, okay, sorry for the error because we have some difficulty here. So I continue with with my presentation. Okay, now after this one, another pharmacy role in the pharmacy hospital. So what we do is compounding. So what is compounding? So compounding is to combine and mix of substance product tailored to the needs and quantity of an individual. For example, like we make a solution from tablets by crushing it and mix with syrup. Here the brief for the compounding process. So when we look at the picture here, we can see there is a mortar here. Then we put a tablet inside the mortar to crush the tablet until it become a fine powder. So after the tablet become a fine powder, we put a syrup to dilute the tablet to make it in a liquid form. So after we make sure the solution are clear with particle, then we can transfer the solution into the container. This is the final product of the compounding. Normally, when we do the compounding, because of the most of them is from the pit patient, because pits cannot eat the tablet, so we have to make a tablet into the liquid for the pits. So another pharmacy technician role is to prepare a sterile technique. One of the example of sterile technique is cytotoxic drug reconstitution. So what is the cytotoxic drug reconstitution? So it's a process in preparing a ready-to-use form of chemotherapy agent, be it bolus or infusion, for individualized patient. So from the picture here, we can see a pharmacy technician is preparing the cytotoxic drug reconstitution. From here, we can see that there is a solution, then there is a vial. So the vial is a cytotoxic drug. We have to prepare it and put in the solution. Most of the patient who receive this treatment are a cancer patient. So next preparation that we are using aseptic technique is a total parenteral nutrition. So total parenteral nutrition is a method of feeding that bypass the gastrointestinal tract. A special formula given through a vein provides most of the nutrient the body needs. The method is used when someone can't or shouldn't receive feeding or fluid by mouth. So from the picture here, we can see there is a solution, a TPM bag, and a lot of syringe in the preparation room. So we put all the syringe, the solution in the syringe into the TPM bag, which is the ingredient of the syringe is a nutrition for the patient. After the pharmacy technician has prepared the TPN, so the TPN bag will send to the ward, and the nurse will give infusion to the patient. So from the picture, we can see the nurse giving the TPN through infusion to the patient. Okay, now how we can become a certified pharmacy technician? So to be a certified pharmacy technician, we have to enroll in 3 years diploma in pharmacy and must have MQA approved, and we have to completed all the courses offered, including the semester 5 and 6 field training, hospital, community pharmacy based. And we have to successfully pass all the exam. And last, we graduate with diploma in pharmacy. So what can pharmacy technician do after finish in pharmacy, or we can further in bachelor in pharmaceutical technology, or also we also can proceed our study in bachelor in business administration, or we can proceed in bachelor in project management. Besides from studies also, we have another choice, which is we can work into the industry. For example, the healthcare industry like government hospital, private hospital, community pharmacy, self-representative, and pharmaceutical industry. So here a few example private hospital in Malaysia. So here we have Pantai Hospital, Columbia Hospital, Prince Court Medical Center, Subang Jaya Medical Center, and KPJ Ampang Puteri. Actually, KPJ have a lot of branches worldwide in Malaysia. Beside the private hospital, for pharmacy technician also can work at the community pharmacy. For example, like the Watson, like Caring, Big Pharmacy, Vita Care Pharmacy, and Guardian Pharmacy. And there are a lot community pharmacy beside of this big pharmacy. And pharmacy technician also can go to be a sales representative to the drug companies. Example is like Pfizer, GSK, Roche, Abbott, and Johnson and Johnson. So actually, what is the sales representative in drug company? So it's actually it represent the company to sell the product to the hospital, to the pharmacy, to the clinic, and they are paying mostly by the base and to hit the target of the sale. And pharmacy technician also can work in the pharmaceutical companies. Pharmaceutical companies is the company that manufacture the medication and devices. For example, like Zepa, Ho Pharmacy, Yufa Pharmaceutical, Pharmaniaga, Royce, and SM Pharmaceutical. Okay, from here we can see the salary for fresh graduate diploma in pharmacy. Okay, for the government hospital, the salary is about RM 2,000 ringgit, and this is not include the allowance for the government servant. For the private hospital, the range for the salary is around 1,800 ringgit, 2,500 ringgit, and for the sales rep, the range is around 1,800 ringgit to 2,200 ringgit, and they can get more based on the commission and sales target. And for the pharmaceutical industry, the range for the salary is around 1,600 ringgit and 1,800 ringgit. And for the community pharmacy, the range around 1,500. So in summary, a pharmacy technician can do all the support tasks but have a few added responsibilities and powers that bound to rules and regulation. Basically, there are a lot of opportunities after you finish your diploma in pharmacy. So there is an entry requirement for the diploma in pharmacy. So in SPM, you have to pass at least 3 credits, including one science subject: biology, physics, chemistry, general science, and other 2 subjects. And candidates who want to further their study in the degree of E-degree in pharmacy or B.Pharm, they at least must obtain minima 5B in biology, chemistry, physics, mathematics or additional math, and one other subject at SPM level. Or you also can go into the diploma pharmacy by doing the O level with pass with minima grade C in 3 subjects. So career development of pharmacy technician. So if you want to further your study in the bachelor in pharmacy, you have to pass in SPM with at least grade C with Bahasa Malaysia and English. And for the STPM, you have to get CGPA 3.0 and other 3 subjects: biology, chemistry, physics, mathematics, including BN chemistry. Or you can enter into the degree in pharmacy doing by A level. Okay, biology, chemistry, physics, mathematics, including BN chemistry. Or you can go to the degree by using your diploma in pharmacy, which is you have to have minimum CGPA 3.5 and above. Okay, for the career development to further study in the Bachelor of Science in Pharmaceutical Technology, you have to pass the SPM or STPM with the grade 2.33 in any 2 subjects, or equivalent, you have to have SPM with 3 credit in mathematics, 1 science subject, and 1 any other subject or equivalent. PharmTech by doing matriculation with CGPA 2.33, or from diploma pharmacy with minimum CGPA is 2.75. Okay, I think until here my presentation. So is there any question?
All right. Thank you, Mr. Sharizal. So it was very interesting, and I learned a lot about the role of pharmacy technicians. I think generally pharmacy technicians have been quite overlooked in their responsibilities in hospital and community settings. So to the audience, if you have any questions, you can type it out in the comment section of Facebook or YouTube Live. So in whatever platform that you are viewing it. For myself, actually, Mr. Charizal, I have a couple of questions. So I think for me, Mr. Charizal, you have been working for almost 13, 14 years, and I would like to ask you
Okay.
what are some of the advices that you can give towards anyone that is interested in being a pharmacy technician.
Okay, what advice can I give is to further in diploma in pharmacy, you have to get the first the qualification that I said just now, and also you have determination not only to take until diploma, you have to further your study until bachelor or master, master in pharmacy.
All right. Okay. Thank you, Mr. Sharizal. So for Madam Wati, you've been working in hospitals for quite some time. So you have worked in hospitals and in community pharmacies, I believe. So what do you think are the most important qualities of a pharmacy technician that you can observe?
Okay, from my experience, the two most important qualities for a pharmacy technician are first, adept communication skills. They must have strong communication skills, and the second one is they must be detail oriented. Adept communication skills meaning a pharmacy technician, adept communication skills is a very highly desirable trait for a pharmacy technician, and it can apply to both their colleagues and also customers and patients. And a pharmacy technicians actually needs to be a compassionate and empathetic listener, and they also need to employ tact and diplomacy when dealing with sick or frustrated customers is important to success in this career field. And for the second one, they must be a detail-oriented person, meaning that every last detail is very critical. From the spelling of the medication to exactly the right dosage, the patient's life may depend on the pharmacy technician accuracy because they are assisting and helping the pharmacists in their daily tasks. Especially now, we are concentrating on towards patient-oriented compared to in the previous old days, we are all concentrating on dispensing medications only. So because we don't want to have any complications either, whether it is related to the person's health or due to the mistakes by the pharmacy technicians or the pharmacists themselves. So that is why these are the two important qualities that must be have or obtained by the pharmacy technician. Thank you, Mr. Danish.
All right, okay, Menawati. But I would just like
Any
to
more
add
questions?
on. Yeah, I would like to just add on a bit to you talked about being detail oriented. I would like to think that in what way do you have to be detail oriented? So, for example, if will you be doing a lot of calculation or will you be doing a lot of writing? So, what in what form do you have to be detail oriented? So, in what way?
Yeah, is it the question for me to answer or Mr. Jariza?
For you, I
For
think
me?
Menawati, because yeah, I think because you have
Okay.
worked with pharmacy technicians before as a superior. So,
Yeah.
for example, if I'm coming in and I am not that good in mathematics per se, then do you think having really good mathematical skills? Do you think you really have to have good bookkeeping skills? Those are in the way that having being extremely detail oriented will actually help you in your profession.
Yes, because first when they receive prescription, okay, they have to screen through the prescriptions and then try to assist the pharmacist too in their own capabilities to find is there any errors. At the same time, when before they can supply the medications, they have to do some calculations, okay, and then a lot of calculation will be involved in calculating the tablets, the pills, or maybe the dose. So that's why mathematical aspects is very important aspects, especially in students undergoing for the or prospective students who are planning to register as a diploma in pharmacy students.
Hmm. Okay, thank you, Menawati. So, how about you, Mr. Charizal? Do you think in what form have you become more detail oriented as you progress through your career as a pharmacy technician?
Okay, in my experience, actually, a pharmacy technician must have a detail oriented because we are dealing with the patient. So every drug through the every when we screening the prescription, the drugs, the route of administration, the dose, we have to very carefully and make sure it's correct dose. Otherwise, it will harm to the patient and may cause uh, like like more damage to the patient.
Okay, so Mr. Sharizal, throughout your experience, throughout 13 years, have you heard or have you seen cases where there is a mistake in the prescription and the pharmacy technician was able to pick it up?
Uh, okay, during my time, actually, there is a lot of mistake in the prescription, like a dose, like a route of administration, like the form of the drug. So that is our responsibility as pharmacy technician to detect the error before we give to the patient. So yeah, quite a lot that we found a mistake in prescription. Then we managed to get the error before go to the patient.
I see. So, Mr. Sharizal, usually what is the number of errors that you face every day? Is it a daily thing or is it a weekly thing, a monthly thing? How often do you find those mistakes?
Uh, Okay, actually, it's not a daily thing because at the hospital there is a target like below 6 error in 100,000 line item. So it's not happen every day, but it's
Hmm.
happen like a month.
Okay, yeah, I understand that. So just one last question, if you will. I would like to ask both of you, if both of you can answer me, is that if for example, if I do my diploma in pharmacy here in Malaysia, is there a chance for me to actually work abroad? So,
Maybe
Menawati, do
Mr.
you want to go
Shariza
first?
can.
Yeah. Oh, Mr.
Okay,
Sharizal,
I
yeah.
thought Mr. Shariza want to answer first.
Okay. Oh, okay. From my experience, actually, because I have a lot of friends who also a pharmacy technician. So currently, what I know is 3 countries uh, receive pharmacy technician Malaysian pharmacy technician, which is in Singapore, Qatar, and the Brunei. And all of the country, I have friends who work there.
So how about the other countries? The other countries they can't really accept Malaysian pharmacy technicians,
Because
Malaysian
I think
graduated pharmacy technicians.
currently pharmacy technician in Malaysia is not certificate by the government yet. So if you
Hmm.
want to go to the other country, the government has to give certificate like a nurse to abroad. Like nurse have their own certificate, a licensed nurse. But currently in Malaysia, there are no license for pharmacy technician.
Yep, yep. I understand that. So, Madam Wati, do you have anything you would like to add on Mr. Sharizal's
Uh,
points?
okay, from my experience here in Masa, okay, for the past, I think, 10 to 12 years, we have many students who have already started their journey, career journey in Singapore. So then most of them are diploma students, okay, and then they just need some certification from the university saying that they have completed the programs and what are the syllabus that we have covered already. Then only they will be accepted as to be employed in Singapore. That is what I have experienced previously because I think many of our students have already got a job placement in Singapore. Yeah.
I see. Thank you, Madam Wati. So, one last question.
Okay.
What do you think are the differences between the diploma in pharmacy program that we are offering here in Masa as opposed to the other universities?
Okay, Mr.
So, Madam
Shariza,
Wati?
maybe you have experience or myself, Mr. Shariza?
Yeah, yeah, yeah.
Okay.
So, any one of you can actually go first, actually. So, Ms. Sharizal, what do you
I
think?
Okay, what I'm thinking is the for the master student, we exposing them more to the attachment, like we are doing the pharmacy attachment at the hospital. We also doing the pharmacy attachment at the community pharmacy. We also doing the pharmacy attachment at the private hospital. And most of the graduate diploma pharmacy, they will go to the private hospital. So we have I mean give them the opportunity to have attachment at the private hospital to familiar with the system, everything. Okay.
Madam Wati, anything you would like to add on?
For me, maybe in general, it is a little bit similar if you're comparing the syllabus. Okay, syllabus coverage from first semester until fourth semester, and then for the final year, they will be going for the attachment. Maybe the one that we have to emphasize is the professionalism of our students, the attitudes. We have to shape them, we have to nurture them so that when they graduated from Masa University, they will be among the graduates that will be employed by the facilities and pharmaceutical industries. That is what we as the educators here, we have to emphasize on that too, beside the coverage of syllabus. This from my point of view, Mr. Danish. Yeah, thank
All
you.
right. Okay. Okay. So thank you so much, Menawati and Mr. Charizal. Since we have not received any questions in the comment section, I would like to say thank you to all our viewers and actually happy Chinese New Year as well. So with this, I will end our broadcast, and it was nice talking to you, and I will see you for the next one. Thank you.